Hey there. Today we're going to talk about something that a lot of dog owners face, urinary tract infections, or UTIs. It can be really stressful when you see your dog is uncomfortable or their habits suddenly change. So we're going to break it all down and give you some clear, straightforward info.
So, does this sound familiar? Your dog, who has been perfectly house-trained for years, is suddenly whining at the door every 30 minutes. Or worse, you're finding little accidents around the house. These are classic signs, and they're your first clue that something might be up. We're going to walk through what a UTI actually is, which dogs are most at risk, what signs to look for, and how your vet can help your best friend feel like themselves again.
And if you're going through this, you are definitely not alone. About 14% of all dogs, that's more than 1 in every 10, will get a UTI at some point in their life. It's one of the most common infections that we vets see. All right, so what is a urinary tract infection, really? It seems simple enough, but let's take a closer look at what's actually happening inside your dog's body.
Okay, so a UTI is an infection anywhere along the urinary path, that whole plumbing system. But 9 times out of 10, when we say UTI, we're talking about a bacterial infection that's set up shop in the bladder. The fancy vet term is bacterial cystitis, which just means bacteria are causing inflammation in the bladder. Simple as that.
So how does this even happen? Well, your dog's bladder is supposed to be a totally sterile environment. No germs allowed. A UTI happens when bacteria, usually just normal bacteria from their skin, manage to travel up the urethra. I like to think of it like they're climbing a ladder, making their way up into the bladder where they can start to multiply and cause all that trouble and discomfort.
But why do some dogs get them and others don't? Well, it turns out it's not totally random. There are a few key things that can make a dog more likely to get a UTI.
Female dogs are definitely at the top of the list, and it really just comes down to basic anatomy. Their urethra is shorter and wider, which gives bacteria an easier, shorter path to climb into the bladder. Older dogs, say over the age of 7, are also more susceptible, along with any dogs that have other underlying health problems that might weaken their immune system.
You know, sometimes a UTI is actually a symptom of a bigger issue. For instance, dogs with diabetes have sugar in their urine, which is like a feast for bacteria. Things like Cushing's disease can weaken their body's defenses, and bladder stones can act like little hiding places for bacteria, making infections come back again and again.
Okay, so let's talk about what you should actually be looking for at home. Your dog can't just tell you what's wrong, but believe me, they send out some pretty clear signals if you know how to read them.
One of the biggest clues is that constant need to go outside, but then they only pee a tiny bit. You might also see them straining, or even hear a little whimper when they try to go. That's a sure sign of pain. And of course, a well-behaved dog suddenly having accidents is a huge red flag. You might also notice them licking themselves down there a lot more, or see that their urine looks cloudy, bloody, or just has a really strong smell.
And that's really the most important thing to remember. You know your dog better than anyone on this planet. Noticing those small changes and trusting your gut that something isn't right, that is the first and most critical step to getting them the help they need.
So, you've seen the signs, and you've made that call to the vet. Awesome. Now what? Knowing what's going to happen during the visit can make it a whole lot less stressful for both you and your dog.
Your vet has a pretty clear game plan. It'll start with a good physical exam, feeling your dog's belly to see if the bladder is painful or feels thickened, but the key is getting a urine sample. Often the best way is a quick procedure called a cystocentesis. It sounds intimidating, but it's just using a tiny needle to get a perfectly clean sample right from the bladder. That sample is what we need for the next 2 steps, the urinalysis and the culture.
So these 2 tests are very different, but they work together. Think of the urinalysis as the initial detective work. It's a fast screening test that looks for clues, like, hey, are there white blood cells or bacteria here? The urine culture, though, that's the real forensic work. We actually grow the bacteria from the sample to find out exactly what kind it is. And this is the most important part, which antibiotic will be the most effective at killing it.
Once we have a diagnosis, we can switch gears to treatment. And here's the good news, the vast majority of simple UTIs are very, very treatable. Your dog can be feeling a whole lot better and fast.
The treatment plan is usually a multi-part attack. The absolute cornerstone is antibiotics to wipe out that bacterial infection. Your vet will probably also prescribe some pain medication to make your dog more comfortable right away. Encouraging them to drink more water is also a big help, because it literally helps flush the bad stuff out. And of course, if we found an underlying problem, we'll start treating that too.
Okay, now listen up, because this is probably the most important piece of advice I can give you. Even if your dog seems 100% back to normal after just a few days, you must finish the entire course of antibiotics. If you stop early, some of the tougher bacteria can survive, and the infection can come roaring back.
Even worse, it helps create antibiotic-resistant superbugs, which are a nightmare to treat. Now, I get this question all the time. Hey doc, what about those cranberry supplements I saw at the pet store? Can I just try something at home first? It's a totally fair question.
And here's the honest answer. While home remedies like cranberry extract are unlikely to cause harm, there just isn't solid scientific evidence that they can actually cure an active bacterial infection. A UTI is a medical issue and it's painful. Delaying a visit to the vet only means your dog stays in discomfort longer and it risks the infection spreading. The safest, most effective, and kindest thing you can do is get a proper diagnosis and the right prescription from your vet.
So what does this all boil down to? It's really about partnership. You are the world's leading expert on your dog's day-to-day behavior. Your vet is the expert in medicine. When you bring your careful observations to their expert care, that's when the magic happens. That's the best possible team for keeping your dog healthy. Remember, this information is for educational purposes and is not a substitute for professional veterinarian advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life.